When we talk about opioids staying in your system, there's a couple ways to define it. Are you asking how long it has an active effect on your body? Or are you asking how long an opioid will show up on a urine drug test? So let's break it down. When it comes to its duration of action, i.e. how long it's going to have its opioid effects, this depends on the type of opioid. Generally, opioids fall under two categories, short-acting and long-acting. Short-acting opioids are morphine, hydrocodone, which is in Norco, oxycodone, which is in Vicodin and Percocet, heroin, tramadol, and fentanyl. These opioids usually have an effect for between 30 minutes to 4 hours. Then there are long-acting opioids like methadone and amiscotin, sustained-release morphine, that have an effect for 12 to 24 hours. Now, the second version of the question is, how long until a urine drug test turns negative for the opioid? Well, this is also complicated because it depends on a lot of factors. One factor is your own body, your own metabolism, your liver and kidney function. If you're older, if you have other health conditions, or you're taking certain medications, it might take longer for your body to get rid of the opioid. Another factor is your opioid use. What kind of opioid have you been using? Is it long-acting or short-acting? Heroin might only turn up in your urine for 1 to 2 days after using it, but methadone will probably stay in your urine for 3 days or more. Also, how much and how frequently have you been using the opioid? If you've been using fentanyl for 1 week, it'll probably show up in your urine for a few days. But if you've been using fentanyl for months or years, it can be positive for 2 to 3 weeks. And the reason for this is that some opioids, especially fentanyl, are very lipophilic, meaning fat-loving. This just means they're oily and they can hide out in your fat cells, even if you've stopped using fentanyl for a while. This is also why fentanyl withdrawal can last so long. And a third factor is the drug test itself. What is the test actually able to find? A urine drug test might only test for opiates, meaning it won't detect oxycodone, methadone, buprenorphine, or fentanyl. And then what fluid or tissue is the drug test actually testing? A drug test that uses blood or saliva will detect opioids minutes after use, while a test that uses sweat or hair will detect opioids for weeks to months after use. So there's a lot of different factors when it comes to figuring out when opioids will turn up negative in your urine.